Hey, good morning to everyone. The Committee on Health, Hospitals, and Human Services is now on the record, and I want to say a special good morning to all of my colleagues, the listening and viewing audience, and also to all of the invited testifiers here today. As always, we give thanks and praises to the Most High and blessings to all. I hope everyone enjoyed themselves at the St. John celebration this past week. It's cherished time, a lot of culture and carnival spirit. This year's festivities kicked off with the opening of the St. John Celebration Village, named in honor of Claudine Scatliff Daniels. My family is the Scatliff. My grandfather is a Scatliff. I'm sure we're related. Going back, the St. Jonians and the Tortolians have a lot. I'm going to research that. It was good. Cool sessions, brass, opening night. A lot of good performers, including Sean Paul, Asa Bantan, Patricia Roberts. The grand finale on July 4th was a spectacular parade. Moko Jumbis, all of that. A special thanks to all of the ferry operators, Valac Ventures, Transportation Services, for running a smooth operation. Thousands of people were going back and forth every 30 minutes. So I'd like to also recognize that July is National Minority Health Awareness Month. And this observance highlights the unique mental health challenges faced by racial and ethnic minority communities, including the impacts of stigma, economic disparities, and limited access to culturally competent care. It's important that we continue to work to build a healthcare system that addresses these barriers and ensures that every Virgin Islander has access to the support they need. I want to remind the public that help is available. You can call the 988 hotline and they will answer the phone right now. It also serves as a suicide and crisis lifeline, 988. You can call it now and they will answer you. Mr. Clerk, can we please have a roll call?
Good morning. Senator Hubert L. Fredericks. Senator Fredericks present. Senator Marvin A. Blyden. Senator Blyden present. Senator Ray Fonseca.
I'm here.
Senator Ray Fonseca present. Senator Alma Francis Heiliger.
Present.
Senator Heiliger present. Senator Kenneth L. Gittins. Senator Gittins absent. Senator Milton E. Potter.
Here.
Senator Potter present. Senator Kurt A. Vele. Senator Vele absent. Mr. Chair, 5 present, 2 absent. You have a quorum.
Thank you, Mr. Chair. Any correspondence to be read into the record? Mr. Clerk?
Yes.
Please proceed.
Yes, Mr. Chairman. Honorable Ray Fonseca, Chairman, Committee on Health, Hospital and Human Services, 36th Legislature of the Virgin Islands. Good day, Chairman Fonseca. I hope this message finds you well. I respectfully request to be excused from the Health, Hospital and Human Services hearing scheduled for today, July 7, 2025, due to unforeseen circumstances that required my immediate attention. I note the importance of today's hearing, and in line with standard protocol, I kindly request that all material from today's hearing not previously shared on the legislative drive be made available to my office. I will review them and follow up whenever necessary. I apologize for any inconvenience my office may have caused. Thank you for your understanding, and I wish you an efficient and productive hearing. Kind regards, Senator Kenneth L. Gittins, Vice President.
Thank you, Mr. Clerk.
Mr. Chair.
Can you please read Block 1 into the record?
Honorable Ray Fonseca, Chairman, Committee on Health, Hospital and Human Services, 36th Legislature of the Virgin Islands, Capitol Building, Charlotte Amalie, St. Thomas, Virgin Islands. Dear Chairman Fonseca, I regret to inform you that I will be unable to attend today's Committee on Health, Hospital and Human Services meeting scheduled for Monday, July 7, 2025, due to a prior commitment. I apologize for any inconvenience this may cause and kindly request that any pertinent information or updates be forwarded to my office. Thank you for your understanding. Sincerely, Kurt A. Vele, Senator, 36th Legislature of the Virgin Islands. That concludes the reading.
Thank you, Mr. Clerk. Can you mark Senator Vele and Senator Gittins as excused? Can you please read Block 1, Mr. Clerk, into the record?
Block 1, Bill number 36-0003, an act amending Title 19 Virgin Islands Code relating to nursing homes and assisted living facilities by adding a new Chapter 76 to establish the services that nursing homes and assisted living facilities are required to provide, establishing limitations on financial charges, requirements for visitation, and the rights of a resident, sponsored by Senator Angel L. Bolquez Jr. Invited testifiers, the Honorable Usta Encarnacion, Commissioner, Department of Health, the Honorable Avril E. George, Commissioner, Department of Human Services, Mr. Gordon Ria, Esquire, Attorney General, Department of Justice, Mr. Troy Schuster, Virgin Islands State Director, American Association of Retired Persons. That concludes the reading of Block 1, Mr. Chair.
Thank you, Mr. Clerk. I'll now proceed with a mic check. I want to make sure that the mic is available. Also, we'll start with AG Gordon Ray. You may proceed.
Good morning. Gordon Ray. That sounds good.
Yes. Come down to my left.
Good morning, Assistant Commissioner Tasha Phillips Dorset.
Good morning, Assistant Administrator Kishma Vincent.
Good morning, Director, Residential Services, Ana Velez Martinez.
Online. Teams.
Yes, good morning. This is Troy Deshabir Schuster, State Director, AARP Virgin Islands.
Thank you. Good morning to all. Yes, just mic check.
Good morning. This is Don Gregoire on behalf of the Virgin Islands Water and Power Authority.
Maxwell George, on behalf of Virgin Islands Water and Power Authority.
Okay, thank you very much. Okay, who speaks to this bill? Oh, no. we'll proceed with the testimony. Gordon Ray, you may proceed. Mr.
Thank
AG.
you. Good afternoon, Chairman Ray Fonseca, Committee on Health, Hospitals, and Human Service members, other senators, legislative staff, and the listening and viewing audiences. I am Attorney General Gordon Ray. It's an honor and privilege to appear before you this morning. The Department of Justice appreciates the opportunity to comment on Bill number 36-0003. The Department of Justice has completed a preliminary review of the bill and offers the following comments. Bill number 36-0003, I'm sorry, there's 3 O's and a 3. There you go. Seeks to amend Title 19 of the Virgin Islands Code by adding a new Part 8. I'm sorry, it's a V with 4 I's after it, so I don't know what that should really be. Anyway, nursing homes and related health care facilities. A new Chapter 76, if approved, would cover nursing homes and assisted living facilities. The stated purpose of Bill number 36-0003 is, quote, to establish the services that nursing homes and assisted living facilities are required to provide, limitations on financial charges, requirements for visitation, and the rights of a resident, end quote, and to ensure seniors in the Virgin Islands have a, quote, right to a dignified existence with access to necessary facilities for their care, end quote, through the development of, quote, the necessary policies to ensure that seniors receive adequate care and support, end quote. According to the National Council on Aging, 1 in 5 Americans aged 60 and older reported abuse during the COVID-19 epidemic. These are the cases authorities know about. Another study estimated that only 1 in 24 cases of abuse are reported to authorities. Factors such as age, disability, and social isolation may make residents of a nursing home more susceptible to abuse. The Centers for Disease Control and Prevention defines elder abuse as an intentional act or failure to act that causes or creates a risk of harm to an older adult. Abuse can include physical, sexual, emotional, psychological, or financial abuse and neglect. Federally, the Centers for Medicare and Medicaid Services, or CMS, enforces the laws and regulations to ensure the health, safety, and quality of care for residents of nursing homes participating in Medicare and Medicaid programs. These nursing homes must comply with federal requirements related to the rights of residents, quality of care, assessments, care plans, health care, dietary services, staffing, and infection control, among others. CMS shares this responsibility with states and territories on the local level. As such, territorial laws should complement federal laws. There are severe consequences for nursing homes found guilty of violating federal and local laws relating to nursing homes, including abuse. Consequences can include loss of patients, loss of Medicare and Medicaid funding, loss of other funding, fines, restitution, suspension of licenses, and closure. Additionally, some states make it a criminal violation for an individual to abuse a resident of a nursing home. Staff members who physically abuse patients may be charged with assault, battery, criminal neglect, or a specific law aimed at preventing elder abuse. In California, anyone found guilty of willfully or repeatedly violating the law is guilty of a misdemeanor and can be punished by a fine of up to $2,500, imprisonment for up to 180 days, or both. Because states and territories have the autonomy to enact their own laws to protect seniors from certain individuals and residential facilities, the scope and application of these laws vary greatly. The Department of Justice supports Bill number 36-0003 in principle. With that said, the following should be considered as this committee reviews Bill number 36-0003. First, the bill doesn't specifically designate which GVI agency will have oversight of the territory's nursing homes and assisted living facilities. This agency should be responsible for conducting on-site surveys of nursing homes and assisted living facilities and reporting the results to CMS to determine whether they are complying with federal requirements. In addition to working with the federal government to enforce regulations and ensure compliance, the local agency can create additional rules and require more frequent inspections. I would recommend that the Virgin Islands Department of Health be memorialized as the government of the Virgin Islands agency charged with oversight of the territory's nursing homes and assisted living facilities. And I might add here, I understand that since my testimony was prepared, the Department of Human Services has also been considered as a possibility, and I would support that fully as well. Additionally, Bill number 36-0003 does not include a system for reporting violations of the proposed legislation. A reporting mechanism will help protect seniors by identifying and addressing violations, leading to earlier interventions, greater data collection, better victim support, more accountability, and public awareness. I believe that the Department of Health or the Department of Human Services would be appropriate agencies to receive, investigate, and manage claims of violations of the proposed legislation. The decision to codify the services that nursing homes and assisted living facilities are required to provide, limitations on financial charges, requirements for visitation, and the rights of residents is a policy decision, not a legal one. However, should this legislature decide to approve this measure, the Virgin Islands Department of Justice stands ready to enforce the law and prosecute violations. I thank the committee for allowing the Department of Justice to testify on Bill number 36-0003. This concludes my formal remarks, and I respectfully welcome any questions this body may have.
Thank you, Attorney General Gordon C. Ray. Who speaks to this bill? Senator Angel Bolkes, you're recognized.
Thank you, Mr. Chair. Good morning, Mr. Chair. Good morning, colleagues. I introduced Bill number 36-0003, a measure that strengthens the standard of care, transparency, and dignity for our most vulnerable residents, our seniors and individuals living with disabilities, who reside in nursing homes and assisted living facilities across the Virgin Islands. This bill establishes a comprehensive framework in Title 19 of the Virgin Islands Code that clearly outlines the required services facilities must provide, protects residents from excessive or unauthorized charges, ensures meaningful visitation rights, and codifies critical resident protections already reflected in federal law under Medicare and Medicaid standards. It prohibits facilities from conditioning admission on prepayment for services covered by Medicaid or Medicare, and mandates full disclosure of non-covered services and associated costs. Beyond these protective measures, the bill also ensures that residents are supported with basic life-sustaining services such as hygiene, nutrition, communication, and mobility, that no resident is discriminated against based on income, disability, or their need for financial assistance, that residents and their families are informed of all available federal and local financial aid and are assisted in applying for such, that residents have the right to designate legal representatives through valid legal documentation such as powers of attorney or healthcare proxies, that facilities policies must be made public and accessible and reviewed annually and submitted to the Virgin Islands Department of Human Services for review and oversight, and that facilities are required to submit written compliance plans with timelines that are held accountable through enforcement mechanisms if they fail to comply. Importantly, the concerns raised by the Attorney General have been addressed through amendment number 36-406, which will be introduced and adopted to strengthen the bill, and the amendment includes a clear designation of the Virgin Islands Department of Human Services as the territorial agency responsible for oversight, technical assistance, and monitoring of compliance. A requirement that each facility submit a written compliance plan within 90 days and fully met service obligations within 12 months. Penalties for non-compliance to be established by regulation, and a directive for the department to maintain and publish a reference guide on reimbursable services under Medicaid and Medicare, and to aid transparency and accountability. While the original bill focused on codifying services and rights, this amendment ensures operational enforcement, agency oversight, and a path for accountability, responding directly to the Attorney General's request, in addition to very high collaboration with the Department of Human Services, who also had many recommendations to provide, which I thank them for. In addition, these services are not optional or discretionary. They are a condition under 42 CFR 483 and participation in the federal Medicare and Medicaid programs. Bill number 36-0003 does not create new federal obligations, but rather aligns and reinforces these protections under the Virgin Islands Code to ensure that they are respected, enforced, and consistently applied here at the local level. In doing so, we affirm that the Virgin Islands we affirm that no Virgin Islander should not be denied of care or suffer diminished quality of life due to the financial hardship or lack of representation or unclear policies. I respectfully ask colleagues for you to support this legislation, and I look forward to working with each of you to ensure that its effective implementation is to benefit our seniors, their families, and the integrity of long-term care in our territory. Thank you, Mr. Chair.
Thank you, Senator Bolkes. Next, we'll go to Troy Deshabert-Schuster, AARP. You may proceed.
Sorry, had to unmute myself. Here I am. Good day, Honorable Senator Ray Fonseca, Chair of the Committee on Health, Hospitals, and Human Services, and Senators of the 36th Legislature. Thank you for the opportunity to provide comments on this discussion about establishing standards and protections of our older Virgin Islanders. This legislation not only acknowledges their enormous contributions, but also creates a pathway for a comprehensive continuum of care that reflects the unique values of the Virgin Islands. As the State Director of AARP in the Virgin Islands and a proud native son, I have seen these islands shaped by persons of great strength and resilience. They are the matriarchs and patriarchs of our families and bearers of our rich culture, deserving to live with dignity and deserving to remain in their island home as they age. I'm pleased to present this testimony in strong support of this legislation sponsored by Senator Angel Bolkes Jr. Today, I'm here not only on behalf of the more than 22,000 AARP members living in this territory, but on behalf of the elders of this community and those generations to come. This bill signifies a monumental turning point in long-term care policy for the territory. The U.S. Virgin Islands is rapidly aging. According to the U.S. Census Bureau, over 20% of our population is now age 60 and older, with projections showing continued growth in our aging population over the next 2 decades. Yet, our territory currently lacks the infrastructure necessary to meet this demand. We no longer have a Medicare, Medicaid certified nursing home. Our elders, our beloved bearers of culture, faith, and wisdom, are aging without adequate supports, and our caregivers, mostly family members, are overburdened and under-resourced. With this reality, many Virgin Islanders are forced to seek costly and often isolating care options off-island. This bill introduces long overdue structures and definitions, and for that we commend Senator Bolkes. We support this bill as a step in the right direction, putting the needs of older adults first by focusing on the kind of care and support they need, that we all need and deserve, right here at home. But support must come with clarity. AARP is concerned that unless this legislation is strengthened with clear federal Medicaid alignment and rooted in community-focused care, it risks replicating the very systems that continue to fail elders across the mainland United States. At AARP, our values are rooted in dignity, equity, and transparency. We believe all people, especially those living in this territory, who are often excluded because of our geographical location, deserve care models that are culturally sensitive and the untethered right to age in place with dignity. We also believe that this care can be delivered in an innovative, appropriate way right here in our island home. As it stands, federal funding streams that have too long bypassed this community are available to us if we do this right. AARP has drafted a package of amendments that we are ready to share with Senator Bolkes. My testimony today will highlight the core values these amendments present, so that with our support, this bill can evolve from promising to transformative. First, expand definitions for justice-aligned care. The law must define terms such as small home nursing homes and community-based services and person-centered planning in ways that align with Medicaid 1915 and 1115 waiver dollars to unlock federal partnership and opportunities for investment. Next, establish transparent licensing and oversight. New licensing language must require clear staffing ratios, workforce training standards, and greenhouse model alignment for small home care. This is how we ensure high-quality, patient-centered care. Next, build a true continuum of care plan, not an institution. This bill must pivot toward home and community-based care as the ideal model of care. Virgin Islanders deserve more than nursing homes. We can build deinstitutionalized, intergenerational, inclusive systems from the ground up. Next, codify the right to access and oversight. Mandate the development and submission of Medicaid state plan amendments and federal waiver applications by 2028. Prioritize local governance, including elders, caregivers, community advocates, and community leaders in all oversight boards. Furthermore, promote equity, accountability, and workforce development. Empower a new care workforce rooted in universal worker models. Require transparency, public reporting, and ongoing monitoring systems that protects both workers and those they serve. Beyond the care benefits, this legislation can serve as a powerful economic driver for the Virgin Islands, creating a system of Medicaid-supported small homes and HCBS programs would generate new employment opportunities in the caregiving and health services fields and pathways to private investments. It would allow Virgin Islanders to receive specialized training and fair wages while providing care to our elders within their communities. The bill, as amended, can serve not only as a care strategy, but also as an economic development engine for the Virgin Islands, one that is most needed right now. We also recognize the importance of cultural relevance in care. Too often, care systems in mainland disregard the cultural values of the populations they serve. The Virgin Islands has a unique heritage that must be embedded into any long-term care framework. This includes hiring staff who are for us, about us, and understand the importance of honoring the family-centered caregiving that is the foundation of our communities. The time for us to act now has come. We have a rare opportunity to shape a system that not only meets compliance standards, but truly reflects the values, voices, and needs of all Virgin Islanders. The amendments we are proposing will strengthen this bill's foundation and ensure that it fulfills its promise to creating a continuum of care that is just, comprehensive, and sustainable. In conclusion, AARP stands ready to work alongside this body to make this bill a beacon of what aging can look like, not a hand-me-down system from the mainland, but a bold, homegrown future worthy of the elders who built this place and the generations who will inherit it. To the members of this committee, We urge you to support this legislation unanimously when the opportunity to vote arises, and to adopt the proposed amendments as it moves toward the full body. Let your vote reflect a commitment to the well-being and dignity of every Virgin Islander who's contributed to building this community and who deserves to age at home and in dignity. And to our community members, this is your moment. Advocate boldly. Stand with AARP for our elders. Secure your future, which is our future. Let your elected officials know that care for our elders is not an option. It's our moral obligation. Together, we can create a care system that honors our past and protects our future. To this end, Senator Fonseca, we respectfully submit our full amendment package to the legislature and is prepared to assist in its integration into this legislation. Thank you, Senator Bolkes, for this bold and transformative legislation. And I welcome your questions and thank this body for the opportunity to speak on behalf of older Virgin Islanders and their families.
Thank you, Troy Deshabot Schuster of AARP. Next, we'll hear testimony from Department of Human Services, Tasha Dorset Phillips, Assistant Commissioner. You may proceed.
Good morning, Honorable Senator Rick Fonseca, Chairman of the Committee on Health, Hospitals, and Human Services, committee members, and other senators present, colleagues, and the listening and viewing audience. My name is Tasha Phillips Dorset, Assistant Commissioner of the Virgin Islands Department of Human Services. Accompanying me today are Senior Citizens Affairs Assistant Administrator Kishma Vincent and Ana Velez Martinez, Director of Residential Services. On behalf of the Department of Human Services, I'm pleased to testify in strong support of Bill number 36-0003, an act amending Title 19 Virgin Islands Code relating to nursing homes and assisted living facilities by adding a new chapter, 76, to establish the services that nursing homes and assisted living facilities are required to provide, establishing limitations on financial charges, requirements for visitation, and the rights of a resident, proposed by Senator Angel L. Bolkes Jr. As the agency responsible for the oversight and daily administration of nursing homes and assigned living facilities in the Virgin Islands, DHS fully endorses this legislation. This bill is a critical advancement towards fostering improved accommodations, living conditions, and protections for residents, while clearly specifying the services these facilities are mandated to provide alongside important financial safeguards. As the department's own long-term care facilities, the Herbert Grigg Home for the Aged on St. Croix and the Queen Louise Home for the Aged on St. Thomas, our practices already reflect core principles found in this legislation. While not CMS certified, both facilities operate under the standards and guidelines set forth by the Centers for Medicare and Medicaid Services, CMS, to ensure compliance with national expectations for homes for the aged. Admissions are based not on financial means, but on individual needs and placement on the waiting list. Through a long-standing sliding scale policy, all applicants, whether they have no income or modest resources, are assured equal access to services, rights, and dignity of care. This legislation, therefore, reinforces and extends practices that are already central to the department's mission and model of care. The proposed legislation reflects best practices in long-term care policy by defining and requiring assistance with activities of daily living, ADLs, ensuring residents have the right to visitation, representative participation, and protection from coercion, and establishing guardrails around facility billing practices and care responsibilities. The bill creates a framework that supports resident dignity, clinical oversight, and financial transparency, each of which are essential in achieving quality institutional care. Key provisions of the bill. Section 4121 requires facilities to provide necessary service that maintain residents' good nutrition, grooming, and personal hygiene. This includes care that enhances daily living, such as assistance with oral care, mobility support, dining assistance, speech and language therapy, and other functional communication systems. These provisions promote dignity, independence, and quality of life for residents. Section 4122 prohibits facilities from excluding residents based solely on income, removing significant barriers to admission. It also forbids charging residents for any items or services that are covered by Medicaid or Medicare, protecting them from undue financial burdens. This includes nursing services, food and nutrition, activities programs, room and bed maintenance, and routine personal hygiene supplies, such as hair hygiene products, bath soap, and grooming commodities. Medically prescribed special foods or supplements ordered by licensed healthcare providers are likewise exempt from charges to residents. The bill further guarantees residents' rights to organize and participate in resident groups and mandates that facilities provide private spaces for meetings and activities. Residents retain the right to manage their financial affairs and to receive advance notice of any charges the facility may impose. Competent residents also have the right to appoint personal representatives empowered to exercise these rights on their behalf, contingent on valid legal documentation such as notarized powers of attorney or court guardianship orders. We recommend clarifying Section 4124 to explicitly reflect this legal requirement, ensuring clarity and protection of resident autonomy. While the bill comprehensively addresses financial protections, some services listed in Section 4122C may not consistently be covered by Medicaid or Medicare. We recommend continued collaboration to keep guidance current and prevent unintentional financial exposure for residents. While DHS strongly supports the bill's framework, we recommend some amendments to enhance clarity, inclusivity, and practical implementation. Number one, inclusion of adults with disabilities. The bill currently emphasizes seniors, but many adults with disabilities also reside in these facilities and require protections. Amendments adding, quote, and adults with disabilities, end quote, alongside seniors throughout the bill will ensure the legislation reflects the full spectrum of residents served. Item 2, prohibition of admission conditions based on prepayment or financial guarantees. To prevent undue barriers to access, DHS proposes explicitly prohibiting facilities from conditioning admission on prepayment or other financial guarantees for services covered by Medicaid or public assistance programs. This aligns with federal non-discrimination standards and promotes fair access. Item 3, written notification and consent for non-covered services. Facilities should be required to provide residents with clear written notice of any items or services not reimbursable by Medicaid or Medicare, including an itemized list of costs and the option to opt in or opt out without coercion. This amendment promotes transparency and protects residents from surprise charges. 4, assistance with financial aid applications and admissions policy transparency. Facilities should assist eligible residents in applying for public financial assistance programs and maintain publicly accessible policies on admitting residents with limited financial means. DHS will maintain a reference guide on Medicaid and Medicare coverage to aid compliance and resident understanding. Legal documentation for designated representatives to ensure facilities properly recognize representatives. Designation should be supported by valid legal documentation such as notarized powers of attorney, court guardianship orders, or recognized healthcare proxies. 6, phased implementation on a compliance oversight. Given the significant service requirements, DHS recommends a phased implementation period of 12 months post-enactment, with facilities submitting compliance plans within 90 days. DHS will provide technical assistance and enforce compliance through established penalties where necessary. 7, financial protections and billing transparency. Prohibit conditioning admission on prepayment or financial guarantees covered by Medicaid or other public programs. Require written itemized disclosure for any service not covered by Medicaid or Medicare, paired with a voluntary non-coercive opt-in process. mandate facilities to assist residents and their representatives in applying for public assistance and to submit annual admissions policies for regulatory review, empower DHS to maintain a reference guide outlining common Medicaid and Medicare covered services to promote transparency and protect residents. 8, legal representative documentation. Clarify that any appointed representative must present valid legal authorization, such as a notarized power of attorney, court guardianship order, authorized beneficiary representative, or healthcare proxy. This safeguards residents' autonomy or legal rights. 9, phased implementation and oversight. Again, propose a 12-month phased implementation period following the bill's effective date. Facilities should submit compliance plans within 90 days, with DHS providing technical assistance and monitoring. Non-compliance should result in penalties as specified by forthcoming DHS regulations. These amendments are designed to ensure that the bill not only sets important minimum standards, but also reflects the diverse needs of residents, protects their rights with legal precision, and creates a transparent, enforceable framework for financial and operational practices. By prohibiting admission conditioning on financial prepayment for publicly funded services, requiring itemized billing disclosures with a non-coercive opt-in process, and mandating assistance with public benefit applications, the bill will protect residents from undue financial hardship and potential exploitation. The phased implementation approach balances the urgency of improving care with the practical realities faced by facilities, while allowing DHS to provide technical support and enforcement necessary for success. In conclusion, DHS supports Bill 36-0003. How a society cares for its most vulnerable or elderly and disabled residents is a profound measure of its humanity. This legislation will help ensure that residents live with dignity, compassion, and the highest quality of care possible in our territory. We commend the legislature for prioritizing this vital issue and stand ready to support the bill's passage, implementation, and ongoing enforcement. Thank you for the opportunity to testify. The team and myself are happy to answer any questions you may have.
Thank you, Ms. Dorset, Assistant Commissioner. Okay, so we have general full agreement and support from all the testifiers. There's a few little amendments that I'm sure that the bill sponsor has already taken care of. As a matter of fact, we have some amendments before us. I wanted to ask specifically about the Medicaid, the Medicare, the CMS certification. You mentioned that the Herbert Grigg and the Queen Louise home do not at this time meet the certification. The new facilities will meet the certification, am I correct? Once we do the renovations to the new facilities?
Correct, Senator. That is our goal with the construction of the 2 new homes for the aged that are upcoming. While they may not be designated as a skilled nursing facility, they will be designated as a long-term care nursing home facility, and that also will be covered under Medicaid.
Okay, awesome. Okay, so before we go to testifiers, I wanted to recognize my summer employees. I know you guys, you all have to work, in partnership with several local businesses. My staff and myself, especially Jacqueline Freeman, we were able to provide employment for 22 summer employees. So I'd like for you to come forward. I'm being corrected, it's 25. I'd like for you to come forward and give a brief introduction so that the public can see your future plans and what you plan to do. Yes, you come on. The Committee on Health, Hospitals, and Human Services stands in recess for 2 minutes. Yeah, I wanted to. The Committee on Health, Hospitals, and Human Services is back on the record, and we'd like to begin with the introduction of our summer interns, all 25 of them. You may proceed.
Okay. Good morning, senators and the live audience. My name is Nia Roper. I am a rising junior presidential scholar, Dean's List, and honor student at the Virginia State University located in Petersburg, Virginia. I am currently double majoring in accounting and computer information systems with a minor in cybersecurity, and I do plan to become a forensic accountant and work in government accounting. I currently am interning at the Department of Finance, and upon completion of my degree, I do plan to come home as my education can benefit the community. I would like to thank the Honorable Senator Ray Fonseca, the 36th Legislature, Ms. Ebony Serrano, and Mr. Elijah Samuel of Department of Finance for giving me this opportunity and welcoming me with open hands. Thank you.
Good morning, senators and listening audience. My name is Zaisha Watley. I am a junior attending the University of the Virgin Islands in St. Thomas. I am currently majoring in nursing, and my future goal is to become a pediatric nurse. I'm currently also interning at Dr. Les's office. I plan to stay in the Virgin Islands where my skills and education will benefit the people of the Virgin Islands. I would like to thank Ray Fonseca, Dr. Les, the 36th Legislature, and Mrs. Freeman for this opportunity.
Good morning, senators and listening audience. My name is Nilia John Pierre, and I am an upcoming sophomore at the University of the Virgin Islands in St. Thomas. My desired career goal is to become a criminal justice attorney, and I am interning at the Virgin Islands Housing Authority. I look forward to, upon completion of my degree, to return home and share my skills and education so that the people of the Virgin Islands can benefit from this. I would like to thank the Honorable Ray Fonseca, the 36th Legislature, and the U.S. Virgin Islands Housing Authority. Thank you.
Good morning, senators and listening viewers. I am Imani Van Houten. I just graduated from Charlotte Amalia High School. I am currently interning at Celestino White Senior Center. I look forward to go into college to pursue my nursing career, and I would like to give thanks to the Honorable Ria Fonseca and the 36th Legislature and Celestino White for giving me this opportunity.
Good morning, senators and listening audience. My name is Jamil Duane Abbott Jr. I currently reside in Florida. I go to a school named Haggerty High School, and I came down for the summer to spend time with my grandmother, and I just happened to get this amazing opportunity from Jackie Freeman and Senator Ray Fonseca. And I would like to thank all my peers that are standing here with me. And I would like to say that this is not just a job, it's a great opportunity. And I very, very much thank everyone. Thank you.
Good morning, senators and listening audience. My name is Demoy Fredericks. I am a 10th grade student attending Charlotte Mali High School, and I'm interning at Humane Society. Upon graduation, I would like to join the military, and I would like to thank the Honorable Ray Fonseca and the 36th Legislature for this opportunity.
Good morning, senators and listening audience. My name is Shade Henry, and I am an 11th grader at the Charlotte Amalia High School. I am currently interning at the Virgin Islands Housing Authority Oswald Harcourt. Outside of school, I would like to pursue cosmetology to be a nail tech. I would like to thank the Honorable Ray Fonseca and the 36th Legislature and my supervisor, Lenine Powell, for this opportunity.
Good morning, senators and listening audience. My name is Kiana Bugunu, and I am a senior attending the Mighty Rays Ivana Durkin High School. Upon graduation, I look forward to becoming an officer in the Air Force. I am currently interning at the Humane Society. I would like to thank the Honorable Senator Ray Fonseca, the 36th Legislature, and my employer, Becca, for this amazing opportunity.
Good morning, senators and listening audience. My name is Jamali Alec. I am a 12th grade student at Ivana Durkin High School. I am currently interning with A9 Trucking and look forward upon graduation to enroll in the military. I would like to thank Honorable Ray Fonseca, the 36th Legislature of the Virgin Islands, and A9 Trucking for this opportunity.
Good morning, senators and listening audience. My name is Nabila James Bugnu. I am in 11th grade student attending Ivana Durkin High School. I'm currently interning at Powell Summer Camp. I look forward to, upon graduation, to go into the Marines. I would like to thank the Honorable Ray Fonseca and the 36th Legislature and Lisa Donovan for this opportunity.
Good morning, senators and the listening audience. My name is Damari Marsh, and I'm a rising 12th grader at Lake Nona High School located in Orlando, Florida. I'm currently interning at the St. John School of the Arts, and upon graduation, I hope to go to college to pursue a degree in musical theater. I'd like to thank Honorable Ray Fonseca, the 36th Legislature, and my employer, Janae Provost, for this opportunity.
Good morning, senators and the listening audience. My name is Dekai Fredericks, and I am an 11th grade student attending at Charlotte Amali High School. I'm currently interning at Nibs Cuisine. Once I graduate, I would like to pursue a degree in cooking. I would like to thank the Honorable Ray Fonseca, the people of Nibs Cuisine, and the 36th Legislature for this opportunity.
Good morning, senators and listening audience. My name is Conrad Weeks. I am currently in 11th grade and I am attending Charlotte Mali High School. I currently work as an intern in the Management Information Systems office for the legislature. Once I graduate from Charlotte Mali High School, I plan to pursue a career in computer science. I would like to thank the Honorable Senator Ray Fonseca, the 36th Legislature, as well as the Management Information Systems Office for this wonderful opportunity.
Good morning, family and listening audience. I'm Andy LeBlanc. I am an intern at the Humane Society. My goal is to help in caring for animals. I would like to thank the 36th Legislature, Senator Ray Fonseca, and the Humane Society for this opportunity. Thank you.
Good morning, senators and listening audience. My name is Keandre Hodge. I am a 10th grade student attending Charlotte Amalie High School. I am currently interning at Humane Society. I look forward to, upon graduation, to go to the military. I'd like to thank the Honorable Ray Fonseca, the 36th legislature, and Becca for this opportunity.
Good morning, senators and listening audience. My name is J. Eldra Freeman Sterling. I am an alumni of the National Society of High School Scholars and a freshman college student majoring in biochemistry at the University of South Florida. I would like to thank Comprehensive Orthopedic Global for giving me the opportunity to intern there at their establishment. I look forward to returning home upon completion of my degree where my skills and education can benefit the people of the Virgin Islands. I would like to thank the Honorable Ray Fonseca and COG for this opportunity.
Good morning, Senator and the listening audience. My name is Elena Regala. I'm an 11 student attending the Charlotte Amalie High School. I'm currently attending at Virgin Island Authority Services. I look forward to upon graduation to go into the college to pursue a degree in Georgia. I would like to thank the Honorable Ray Fonseca, the 36th legislature, for this opportunity. Thank you.
Good morning, senators and listening audience. My name is Amelia Ambrose. I am a 9th grade student going to 10th, transitioning from Lithonia High School in Georgia to high school here. I am currently interning at Perfect Image by Cynthia. I look forward upon graduation of attending college to pursue a degree as an artist. I would like to thank the Honorable Ray Fonseca, the legislator, and Perfect Image by Cynthia for this opportunity.
Good morning, senators and listening audience. My name is Katara Danielle. I am an 11th grade student at the Charlotte Amalie High School. I am currently interning at the Virgin Islands Housing Authority's office in Oswald Harris Court. Upon graduation, I would like to go to college and pursue a degree in psychology. I would like to thank the Honorable Ray Fonseca, the 36th legislature, and the Virgin Islands Housing Authority for this opportunity.
Good morning, senators and listening audience. My name is Cassandra Ortiz Williams. I am an upcoming senior attending at Avania Dorican High School. My career goal is to be a therapist for the deaf people. I'm currently interning for the Senator Angel Spokane office. At the completion of my degree, I plan to stay where my skill and education will benefit the people of the Virgin Islands. I would like to thank Senator Ray Fonseca, Senator Angel Spokane, and Ms. Freeman for this opportunity.
Awesome. Thank you. Congratulations. Did we miss one?
Good morning, senators and live. Good morning, senators and live audience. My name is Kimani Riley. I'm a senior in college. I'm attending Bluefield University in Virginia. I'm majoring in sports management / business administration. Upon graduation, I would like to come back and make my skills useful for the youth in sports, especially better than when I was playing ball back then. Make sure all the facilities good, so they don't really have to go away unless they get into a major D1, so they can be on a scholarship like I am, and make them more or less stress for college and money. And I would like to thank Honorary Ray Fonseca and the 36th legislature and Mr. Martin and Mr. Armstrong for letting me work at Department of Sports, Park and Recreation.
Thank you, thank you. And all of you are excused so you could go back to work. And thank you, blessing. Okay, so colleagues, we're going to go to a round of 5 minutes. We'll start with Senator Marvin Blyden, followed by Senator Alma Francis Heiliger, followed by Senator Milton Potter, and then we'll have the bill sponsor, Senator Bolkis. Senator Marvin Blyden, you're recognized for your 5 minutes.
Thank you so much, Mr. Chair. Good morning to my colleagues, viewing, listening audiences, staff, central staff, and good morning to the testifier. Thank you so much for your testimonies. Thank you for your recommendations. Thank you for your amendments, because there are many different suggestions and amendments, which I'm sure that the chair is going to use those amendments, and I did sign on as a sponsor of this legislation, a very good piece of legislation. No bill is perfect, but it can all become better, and these amendments are on point. But I have some questions, and many questions for the Department of Human Services in respect to the bill. So, and also my interns also did some research and have some questions for me, so let me get to it. In respect to the bill, right, let me speak to the Department of Human Services. And my first question is, how many licensed nursing facilities are there in the Virgin Islands? And of that number, how many are operated by the government of the Virgin Islands? And to add to that, also, how many are certified, if you know?
So I'll start. Good morning, Senator Blyden. I'll start off. So the two that are run by the Department of Human Services are Herbert Grigg and Queen Louise Home for the Aged. We are not licensed by the Centers for Medicare and Medicaid, and we were grandfathered in to the Certificate of Need process. That's a regulatory process run by the Department of Health. The Department of Health is who would review any application received by a prospective nursing home and allow them to proceed. So to my knowledge, right now, there's one application that they had approved in St. Croix. That's for a new nursing facility that's being built. And it hasn't opened as yet. I don't believe they're finished with construction. And that's it, because Seaview Nursing Home was closed, and Wim Gardens and Lucinda Millen Home are not considered nursing homes. They are assisted living facilities, but oftentimes people confuse the two in the community.
Okay,
I hope that answers your question.
Not necessarily completely, but let me ask you another question in that respect then. In terms of the service, etc., and what the bill intends to do, what about staffing levels? What the level of staffing does the Human Services have in terms of monitoring nursing homes, etc.? Because that's your responsibility, correct?
No, Senator. Right now, currently, the responsibility for monitoring is at the Department of Health through the Certificate of Need process.
To include inspections?
To include inspections. When you apply for a Certificate of Need, Department of Health receives an annual update or annual report from the facility, and then that may or may not trigger an inspection by the Department of Health staff.
Okay, with that being said, I know AG Ray spoke in his testimony in terms of a recommendation with Health and or Human Services, and he said he don't mind either or. So, AG Ray, in respect to oversight to assure that the bill meets its mandate, you said either or, but based on what I'm hearing, and I'm going to ask you also, would you believe Health should be that agency and or Human Services? Attorney Ray first, which one?
I don't have a preference, and
Okay.
I will defer to them.
Okay, very well.
So from the DHS perspective, we would be self-regulating if you assign the overall compliance and monitoring to DHS solely. That's why in our testimony, how we chose to address it is that we would assist and provide technical assistance to any entity who was willing to start up a new nursing home, et cetera, et cetera. But the regulatory role and responsibility right now currently sits with the Department of Health via the Certificate of Need process.
And okay, you spoke to the Certificate of Need process. Also with the bill, I know there's a lot of responsibility in terms of the different mandates. And you spoke in your testimony also to Medicaid, right? You spoke to Medicaid. Does these nursing facilities receive Medicaid even though they are not certified? That's my next question. Do they have to be certified in order to receive Medicaid assistance for those individuals? Explain to us how that process works, please.
Sure, Senator. So it's the resident of the home who would be a Medicaid beneficiary. And so we have some members who reside in Queen Louise and Herbert Grigg that are Medicaid beneficiaries and accessing benefits that way. We have residents who are Medicare beneficiaries, and that pays for some of their prescription costs. I'll use that as an example. But I will defer to our Director of Residential Services, Ms. Ana Velez Martinez, to add on additional information.
Ana Velez Martinez, Director, Residential Services.
Speaking to the mic, speaking to the mic. Don't be speaking to the mic, please.
The Medicare clients at the homes, basically the Medicare is used for the medication. So we don't use the Medicaid. We don't really. It's like Assistant Commissioner said, is used also for partial of the medication purchase, but there's no other payment coming into the home, just for medication is used.
And in closing, Mr. Chair, let me ask again in respect to Medicaid and the resident that you said that they don't want to receive it. Are there any special training for staff to assist those individuals in terms of assuring that those forms are filled out properly? How does that work?
Well, Senator Blyden, in response to that question, generally our application process workflow is either the resident themselves or a family member, if they're coming in from the community, a community-based application. That application would be reviewed by our Adult Protective Services unit in combination with our Homes for the Aged staff. There's a process that they have to do to review it. And then if the person is eligible for Medicaid or they want to refer them to Medicaid, then they will bring in our Medicaid staff in the discussion and the review for the application. The process is slightly different if the person is a boarder coming from the hospital.
And training and compliance is very important. How often do those individuals on staff get training for compliance, etc., in terms of that space? How does that work?
I will pass that on to my colleagues, Assistant Administrator Kishma Vincent and Ana Velez Martinez.
Ana Velez Martinez, the staff are trained annually and also annually based on and also based on need.
Thank you so much for the time, Mr. Chair. I didn't want to abuse it, but thank you so much. Thank you for your responses.
Thank you, Senator Blyden. Those are some good questions. I want to follow up with that CMS certification. Okay, so because it's additional funds and, you know, our government has limited resources. So the Seaview Nursing Home, what is the status of that now? Is it in negotiation or the government is no longer pursuing that?
Well, to my knowledge, Senator Fonseca, that's number one under DPP. They're responsible for the potential purchase of that property. But the Department of Health, the Department of Human Services, and the Office of the Governor have had a few meetings, and one most recently with a company that is interested in doing a public-private partnership for the management of Seaview. So that's where I'll leave it from the DHS perspective at this point. We're doing some analysis right now to determine if that site is better off as just a straight skilled nursing facility or in combination with a behavioral health facility. So these are the conversations that the team has had to date so far.
Okay, Mr. Schuster, I want to ask you a question because you mentioned the population is aging and, you know, our people have to move away for adequate nursing care. And, you know, there was the issue with the Herbert Grigg home. I know, Ms. Martinez, we had mentioned it to you that I think it's 37 or 45. How many units are going to be in the new design for Herbert Grigg? Do you know? But go ahead.
Yeah, Ana Velez Martinez. It's still on the phase of the planning, so we don't have an exact number right now, although we wanted the 80 beds facility, but at this point, it's unknown until they architectural work is done and complete.
Yes.
Sorry, for her, if you're speaking about Herbert Griggs specifically, based on the budget that we have from FEMA to do the renovations and to do a rebuild, right now we're down to about a 60-bed capacity at the most is what we'll be able to do in St. Croix, and I believe in St. Thomas it'll be about 44 beds so far.
And what is the waiting list now on St. Croix and the waiting list on St. Thomas?
25 in St. Croix and 20 in St. Thomas.
Okay. 25 in St. Croix, 20 on St. Thomas. Does that include the boarders in the hospitals?
No.
Okay, so there's about 13 boarders, so you added up 38, so figure that's 40 waiting list plus boarders. What's the current population now at Herbert Griggs?
Kishma Vincent, Assistant Administrator. Okay. Currently at Herbert Griggs, we have 22 residents, and our current capacity is 25 residents. At Queen Louise, our current capacity, our current resident total is 14 residents, and our capacity is at 16.
Okay, so you see, Mr. Schutzer, you see where we're going. We are with the 22 that we have and the 38, that's already the 60. So if we build a new facility of 60, it's already full. So I'll now go to Mr. Schuster. Any comments on that?
Yeah, well, thank you, Senator. Troy Schuster, State Director of AARP in the Virgin Islands. It's certainly not enough, even with what they're planning. It's certainly not enough. It's a good start. But I must say that becoming CMS certified is paramount, right? A lot of people are either struggling to stay at home or leaving the Virgin Islands because the quality of care is not at CMS standards. And I must say again that the staff in both of these homes for the aged are working very hard. They're very sincere people. I've seen them but they don't have the resources they need. They don't have all that they need from the government of the Virgin Islands to really increase and improve the standard of care. And so they're struggling with what they have. So if they are properly funded by the government of the Virgin Islands and they can increase and improve the standard of care to reach CMS standards, it would be my guess that a lot more people will stay in the Virgin Islands. And then that coupled with greater capacity. So there's a lot of work that needs to be done. The plans that they have for these improved and increased facilities is great. But even then, it's still not enough. And the government of the Virgin Islands when I say the government, I mean the legislative and the executive branch both, need to focus on the needs of these homes for the aged and really give them the resources that they need to improve across the board. Because it's not fair to these very, very faithful work homes for the aged to give them minimal tools and say, okay, provide excellent care. It doesn't work. They need more resources, especially financial resources, to do what they need to do.
Yes, and I fully agree. And the elderly care, the assisted living facilities, even the full care facilities, we need to put a lot more resources into this area. Christopher Finch, who was the former chair of the territorial board, always give us these numbers that we should have about 3% of the population that's over 65. We should have 3% of the beds. And the number was like about, it would mean that we need in excess of 300 elderly beds in the community. So definitely we need to put a lot more resources into this. Senator Alma Francis Heilega, you're recognized for your 5 minutes.
Good day to my colleagues, good day to the testifiers, good day to the people of the territory and staff. My first question is directed in regards to the CPR certification. How would that work? I'm reading the legislation. Would the staff now be required to learn that? And what are your thoughts in regards to that?
Let me answer first. Thank you for the question, Senator Francis Heiliger. Well, first of all, most nurses, as part of their Virgin Islands license, have to be CPR certified. So that's inherent, and that's at all nursing levels, RN, LPN, and CNE. I'll let Ms. Velez Martinez answer any other questions.
Ana Velez Martinez, all the requirements for the LPNs and the nurses, it is a requirement before they renew the license that they must be CPR.
Okay. Because I'm looking at one of the things the previous individual, I think it was Dishabert, was sharing, is also a major concern of mine. It's one thing for us to say that we want great service for the people and our seniors, but we as a body have to actually fund these things. And when we're creating legislation to add additional things, I'm very much concerned as to the funding aspect of it. And I want to make sure that, you know, before this even goes anywhere, we have to make sure where the funding going to come from to guarantee that all these additional things that I see in this piece of legislation that are going to now become legal requirements are duly funded. That's part of my biggest concern in making sure we have funding for that. I want to ask the question, with all the services that are listed here that are going to be added on or are going to be made a requirement, how many of them are not being provided right now? Because I know we could put things into law and say we have to do it, but how many of them that you guys might already be providing versus what you would have to now add to the list?
Hi, Kishma Vincent, Assistant Administrator. I could start off by saying that in order for us to be CMS certified, we have to have adequate nurse to patient ratio.
Okay.
And right now we are, we're not quite there yet. So that's one of the big things.
Yeah.
Right?
So where are you actually percentage-wise?
How much you would say, Annie?
Well, right now the ratio's 1 to 10.
Yeah.
Mm-hmm.
When it should be 1 to 7.
Oh. Mm-hmm. Okay, go ahead.
And so that is another situation because, I mean, we're talking about a skilled nursing facility versus a long-term.
Okay.
So there's two different things we're talking about, but basically the ratio should be met.
Okay. And do you have a pathway that you're either working on to potentially get there? What have you guys been doing? I mean, we understand our part with potentially providing funding to pay for the nurses, but is there a pathway that you guys have been working on to potentially recruit or get nurses to these facilities?
Recently, we did request PRFs. Oh, Kishma Vincent, Assistant Administrator. Recently, we did request for PRFs for RN. I'm sorry. Okay. Yeah, recently we did request a PRF for RNs, for LPNs, for CNAs, for both St. Thomas and St. Croix. We have not gotten all our requests as yet, but we are working on getting those positions filled. Let me see here. As well as other areas in the facility, like institutional supervisor, laundry attendant. So, we have quite a few positions that are vacant that we are working, we have requested to have those positions filled.
Okay.
10 seconds.
One of the things in regards to the residents' rights versus the representative rights, how are you going to be potentially, if this bill is passed, dealing with training, et cetera, to make sure it is
Time.
understood the difference between those two.
Ana Velez Martinez, Director, Residential Services. Residents' rights and families' rights, this is something that when there's a pre-admission meeting, it is addressed and we actually go over with the family members or the resident if they're capable, if not the power of attorney or the guardian person.
We'll go to the person representing them.
That's correct.
Okay, understand it. I heard time, so I will acquiesce. Thank you, Mr. Chair, for the time.
Thank you, Senator Alma Francis Heilige. Okay, so point of information, Senator Bolkes, but before I go to you, I'd like to recognize the presence of Senator Clifford Joseph. Welcome, Senator Joseph. Senator Bolkes, you're recognized.
Thank you, Mr. Chair. I just wanted to touch on a few things that were mentioned by some of our colleagues. The bill does not create a new financial mandate. It codifies federally required services already mandated in 42 CFR Part 483. And the bill ensures that local enforcement and transparency mechanisms align with those exact standards. Now, the amendment also includes a phased implementation of 12 months and mandates compliance within 90 days, giving DHS, the Department of Human Services, time to ramp up on their oversight and technical support. Additionally, the Department of Human Services already has statutory authority under Title 19 to regulate long-term care. And this bill just simply clarifies those responsibilities and strengthens tools for accountability. And lastly, by clearly defining residents' rights and transparent billing practices, we can build public trust for long-term care. And this provides a stable, predictable regulatory environment for private investors or private investment. And I think that's the key thing that we really need to focus on here when we talk about finances. And ensuring that these ethical providers are not only undercutting us by providing substandard services, because this is a requirement by federal law. So I just wanted to place that on the record. Thank you for the time, Mr. Chair.
Thank you, Senator Bolkes. I wanted to go back to either Ms. Dorset or Ms. Martinez. So if we were to have the new facility, the 60-bed facility, CMS certified, do you know approximately how much revenues we could collect from Medicaid and Medicare? I know you don't know the exact because you'd have to go to individual circumstances, but more or less, because right now we're collecting nothing, and more or less, how much would that be?
Good morning again, Senator Fonseca. Tasha Phillips Dorset, Assistant Commissioner. I think it's important just to make one clarification. So a skilled nursing facility will be able to bill for Medicaid and Medicare if you are certified. But a long-term nursing home, which is what we are going to be building, you can only build for Medicaid. Medicare does not fund just regular long-term nursing care. So I wanted to put that distinction on the record. Generally, whether we place Medicaid clients off island in a nursing home or through agreements with private partnerships that are under exploration right now, the Medicaid rate is normally around like $320, between $320 and $340 per day. That's what Medicaid is able to pay generally. For our nursing home, we charge for persons who are able to afford it. We're on a sliding fee scale. So if they have no income, there might be some people who can't pay at all. There might be others that have private insurance, so we would pay, whatever their private insurance would pay for the service. And then there are families who chip in. They get all of their family members together and they pay for the cost. We have been able to bill at least up to $5,000 per month for some of those clients that are able to afford it. And I'll let Ms. Velez Martinez add anything else on.
Okay, for just to give an overview of what's going on right now, it's $5,000 a month. But we look at the, pretty much, if we were supposed to get the $5,000, we would probably get $1 million per year. Right now, because there's a lot of non-payment residents, we get like $126,000 a year. So we could be making more money if we were Medicare, or CMS, Medicare, CMS certified.
Good point. And so then you'd be able to reduce your nurse to patient ratio from 1 to 10 to 1 to 7. Okay, well, it makes sense because since we have the ability to renovate the new facility, and you say it's in the design phase, any timelines when it should start and go out to bid?
Sorry, Senator Fonseca. Good morning again. Tasha Phillips Dorset, Assistant Commissioner. For Queen Louise Home, we have to be completely built out by 2028 or the first quarter of 2029. For Herbert Grigg Home, we have a little bit more leeway and time. We have to be renovated by 2032. And again, we're using FEMA disaster recovery monies to do the rebuild because these are the FEMA amounts from Hurricanes Irma and Maria.
Thank you. Senator, point of information, Senator Balkis, proceed.
Thank you, Mr. Chair. Just wanted to chime in on the commentary of Ms. Martinez and Ms. Philip Dorset. Colleagues, a short-term investment is going to be a perpetual long-term savings for the government of the Virgin Islands. I want you to hold that in consideration because I believe the statements that were made are very important when it comes to deliberating on how you want to move forward with this bill. Thank you, Mr. Chair.
Thank you, Senator Balkis. You know, I got to follow up AC Dorset. You're saying that Queen Louise, we have until 2028 to start the construction or to complete the construction?
To complete the construction of the new facility. I'm not talking about the minor repairs that we will be doing on the current Queen Louise once we move those clients to Palm Court Harborview. It's two different things, two different projects. We intend to renovate the current Queen Louise home. Aesthetically, there are some changes that we need to make. We need to fix some tiles. We have to do some work in the kitchen, et cetera, et cetera. And then there's the FEMA build-out that's on a separate piece of property where we will be building out a roughly 44-bed facility on St. Thomas.
Well, Sir Popa, you know, this is about Bill 36003. But if you're saying you have until 2028 to finish that, and we in the middle of 2025, January 2026, you're saying that you have 2 years come January to finish that. How is that going to be possible when you're still in the design phase? How are you going to be finished in 2028?
Well, Queen Louise is further ahead than Herbert Grigg Home for the Aged. Annie?
Because we don't want any federal funds going back and them recapturing those DSRs, et cetera. So it seems that, you know, and human services, right? We concentrate on some other areas, but human services has a lot of DSR funds because you also have the new demolition of the Northampton and the rebuild of the Joe Malloy complex and this Queen Louise. And the Herbert Grigg, those are three massive projects. So you rely on Office of Disaster Recovery to do your design, everything?
Senator, that is correct. And I believe just last week, Tuesday or Wednesday, ODR issued the RFP for the Herbert Grigg construction.
Okay, thank you. Senate President Milton Potter, you're recognized for your 5 minutes.
Thank you very much, Mr. Chair. Good afternoon, colleagues. Especially good afternoon to testifiers. AC Dorset, any anxiety regarding our ability to complete that project by 2028?
Well, there's always going to be anxiety because we have so many major rebuild projects, as Senator Fonseca just outlined in the territory. But we are working with our project managers and ODR and DPP to keep on schedule and keep on track. So we meet weekly on these projects internally, and we're on schedule for all of our projects. I'm looking at a note in our group chat. So I have our grants management coordinator for the disaster projects giving me updates live.
Okay. I won't get nervous until you get nervous. So, AG Ray, I wanted to ask you, what specific criminal penalties do you envision, does your office envision for violations beyond the federal consequences that were mentioned?
Right. It would depend on exactly what the violation was. Obviously, if it's a if it's an assault of some kind or something related to that, obviously we have the coverage of the Virgin Islands Code already, and that we would add on and prosecute. And again, we would have to go to the code depending on what the action was, determine if it is a local criminal offense, and if it is, then prosecute it.
Okay, okay. As far as just the reporting mechanism and how it would work, who could report violations? Residents, families, staff, anonymous tipsters?
Oh, it's reported to us? Yes.
Yeah.
It could be any of those. And I would expect it would be the normal reporting type of system where the report should be made to the police, who would then do the investigation, then bring it to us for prosecution if all of that panned out. And I'm assuming they would do it in conjunction with DHS.
Okay. How does the relationship between the Department of Health and the Department of Human Services regarding oversight of these surgical and long-term residential facilities? I know you have a role as the Department of Human Services concerning nursing homes, the running of nursing homes and human services. I mean, Department of Health, you mentioned the certificate of need, and they would fall under their jurisdiction. How do both agencies interact regarding this oversight of these facilities?
Good morning again. Good afternoon, sorry. Good afternoon, Senator Potter. Tasha Phillips Dorset, Assistant Commissioner, Department of Human Services. Human Services and Department of Health are sister agencies. That's one of our agencies that we work the most with, along with Department of Education. So we're in constant communication on many different projects and issues on a regular basis. So in terms of elder abuse and elder care, we have an adult protective services unit that falls under the oversight of Assistant Administrator Kishma Vincent. And if a case comes in to our offices at DHS and there's a need to involve the health department, then the case management staff reaches out and does so. In terms of regulation, we're not regulating those surgical centers or anything like that from DHS. We run the nursing homes, so we're sort of policing ourselves, but CMS also, if there are any complaints that are sent from clients or anyone in the public directly to CMS, then they would, hold us accountable for what care we are providing or not providing. So even though we're not a licensed nursing home formally, we still have to follow CMS guidelines and mandates as it relates to the treatment of residents within our care.
Understood. I think I may have said surgical centers instead of skilled nursing centers.
Yeah.
So.
Yeah.
With regards to your recommendation that you expand the bill be amended to cover adults with disabilities.
Mm-hmm.
What percentage of the members or the residents in these homes are adults with disabilities versus, I know it's primarily seniors, but what percentage of the membership of these facilities are adults with disabilities?
I will ask my colleague Ana Velez Martinez to answer, but I will say it's a shifting population. We do have churn in our population because we have, patients coming from borders, patients going back into the community, patients unfortunately do pass away, or we have patients that are, residents that are sent off island to live with other family members. So there's a lot of flux in there.
It can look different every week.
Yeah, Ms. Velez, I don't know if you want to add.
Presently, we have one, but when you look at adult with disability, you could also look at it as someone in a wheelchair also, unable to walk or have any limited movements. So when you look at that also, most of our residents in both homes are bed-bound.
Okay. Thank you. I know my time has come, Mr. Chair. If I may just ask one more question. I wanted to just get you to elaborate a little bit, AC Dorset, about what would phased implementation actually look like in practice? Which requirements would be implemented first versus last?
Senator, I'll be honest with you, that would take a little bit more analysis on our part and a deeper dive. I want to be very transparent with the public that we have a very limited staff right now between our APS, our Adult Protective Services units, and our administrative staff at our homes for the aged. Ms. Velez right now is pulling double duty as the director of both homes, and we have interviews scheduled tomorrow. I think we're interviewing 5 candidates just for the director position for Queen Louise. So I'm unable to really give you at this juncture a step-by-step process, but we would have to do, a workflow and a business process plan that will guide us on, how we would split up the year-long process. But I want the public to know we are a small team, but a hardworking team, and we're juggling and balancing a lot for the needs of our senior community.
Understood. And, you would be required to provide technical assistance, which I guess you currently do, for nursing home providers. What does that technical assistance look like?
So I'll give,
Do you have the expertise and staffing for this role?
So I'll give you an example of one type of technical assistance that we provided. We've had to be in communication with the owners of the facility that's being built in St. Croix. There's been several meetings, including our commissioner, our Medicaid staff, and our Homes for the Aged staff. We serve as a sounding board for them to talk about what would be the best services that they can offer in our Virgin Islands community as a private company and a partner. Because with any venture, we're looking at it as governmental public-private partnership in some capacity. So we had to approve their rates that they were going to put into their CMS application. Our commissioner had to sign off on that first. They asked us questions on if moving into the assisted living space, moving into the adult daycare space would be something that would be beneficial for our community. So that so far is the type of technical assistance that we have provided. Additionally, giving entities data in terms of how many dual Medicaid and Medicare clients we have, because we do have a population of dual patients and dual residents, and when we have dual residents, Medicaid is the last payer. So Medicare would be first, Medicaid would be second. So I hope that answers your question as an example.
It does. Thank you very much for your response. Thank you for the flexibility, Mr. Chair.
Thank you, Mr. President. Point of information, Senator Bolkes, you're recognized.
Thank you, Mr. Chair. Mr. Chair, I just wanted to put on the record, well, first and foremost, that the Department of Human Services has worked shoulder to shoulder with me when it comes to comprehensively amending this bill to what you see before you. But one thing that was mentioned, the previous senator alluded to, inclusion of disability in 4120D, which is actually on the blue. What happened is Department of Human Services, being that they've been working with my office and I so long on this, their testimony reflected what would be the BR, which did not include it at the time, but that amendment has made the actual bill itself. You'll see it in 4120D. Also, in addition, when it comes to reporting, as the previous senator also indicated, I believe that we need to find something that is low budget, something that is not too comprehensive for our seniors, because some of them may be technologically not as advanced as others, and perhaps something like a hotline, something of that nature that would be more easier, so we can discuss that as we move forward. Thank you for the time, Mr. Chair.
Thank you, Senator Bolkes. And I know that this is, they have good, hard-working staff in this area. Ms. Martinez, we did a tour of Herbert Grigg, I think it was about 4 months ago. Assistant Commissioner, you were there, you greeted us, and Ms. Martinez, and there was some progress this year as opposed to last year. I noticed that your freezer was full of food, and the residents, were being cared for much better. So there's been some improvements here. Senator Lorenzo Frederick, Vice Chair, you're recognized for your 5 minutes.
Thank you very much, Mr. Chair. Pleasant good morning to my colleagues, the listening and viewing audience, my staff, and obviously the very best central staff as well. I wanted to start having a brief discussion in which, on the surface, I really like this bill. But of course, everything comes at a cost. Assistant Commissioner Dorsett, can you tell us what do we need to do to make these long-term facilities CMS certified so we could get maximum reimbursement?
Good afternoon.
The planned facility.
Oh, sorry.
The planned facilities and the current facilities we have.
So again, I think at times it could be looked at as a toss-up. So with our FEMA rebuilds and the monies that we have to look at bed capacity. And we know that we are already not meeting the bed capacity even with some of our plans that we have. If we have to shift from a long-term nursing facility to one of a skilled nursing facility on that same property, then we would have to sacrifice some of the bed capacity, total number of bed capacity space to build out the area to meet the need for the skilled nursing facility. And those have been some difficult yet crucial conversations that our team has pondered and even at times struggled with, because it's two different levels of care. A skilled nursing facility is more the one where you get that intensive, wound treatment of pressure ulcers and all of that on a more in-depth basis than a regular nursing facility. But on the flip side of it, you have to have more RNs on staff to meet the CMS requirement, and you also have to have a licensed certified nursing home administrator, which there are not very many in the territory and readily available. So the way in which Department of Human Services and ODR have approached it is to look at how can we maximize the FEMA dollars that are being given to us in this one-time opportunity to rebuild and to rebuild both homes. And so that's why we're going the route of the long-term nursing home, which we would be able to get Medicaid certified, not necessarily Medicare, because again, Medicare does not pay for regular long-term nursing home services. And then we would want to enter into some type of public-private partnership with an entity that's able to provide skilled nursing services, which is a higher level of care.
I don't really have a whole lot of time, so sorry to cut you off. In reference to financial modeling that we've done or you've done, have you done any to ascertain whether or not this particular bill that we're discussing, what impact financially would it have overall on your plans?
So we have not done financial modeling at this time, but what I can tell you is overall, our general fund budget yearly for Herbert Grigg Home is only $326,000, and our general fund budget for the Queen Louise Home is $250,000, and then we supplement those budgets with our revolving accounts and the funding that we receive from the payments from the families or from private payers. So that's a step we would have to go forward to.
Might that to be about $150,000 a year?
Ms. Velez, go ahead and answer on the revolving amounts. Generally, what do we trend at?
So the revolving funds from the room and board for St. Croix is about 200,000, and then St. Thomas is about 180 something approximately.
100 and.
But 180 is
Sorry.
based. It can change based on the residents that we have. If it's a full pay, if it's a partial, and sometimes it's zero payment.
Time.
Mr. Chair, if you can, let me just finish up this little line of questioning.
Yes, go ahead.
So we're considering adding more requirements. We don't know what it's going to cost us, but it's necessary. It's important that these patients' rights be protected. When do we ever sit down and start running the numbers to see if it makes sense financially to move forward?
If that's a question directed towards me, my answer would say there should be no price tag on guaranteeing and ensuring that you're providing quality of care to the most vulnerable population. I mean, what Senator Bolkes's bill is doing is just aligning the standard of care with what we should be aligned at in terms of the highest regulatory body, which is CMS. So this is sort of an interim step. Even though we're not CMS certified, we do our best to adhere to that guidance, and this bill codifies it. At least that is my interpretation and understanding of it.
As I agree, I think the bill is important in terms of the patient's protection, but I'm saying there's a cost that comes with all this, and we're blowing that aspect off. It's like, okay, yeah, and we need to provide the highest quality care, but we need to find out what it's going to cost. We need to find out what the Virgin Islands government can afford, which right now we could barely afford what we have. We're not even billing these patients as we should. So how is this going to be a successful project in even in the immediate term or long term? I see problems coming. We have current problems. We could barely take care of the few patients that we have, and we're talking about increasing care without any financial consideration. This is a recipe for problems. I've noticed we've done this historically, and we really need to rethink the way we approach these things. We could do this in terms of small increments, short-term, medium-term, and long-term implementation, but we tend to just throw things out there and we don't consider the cost until afterwards, and then we're stuck trying to find money that we don't have. So that was my only beef about this. I totally agree with you about quality of care being important, but to me, we need to focus on maximum reimbursement from the federal government because we're aligning our quality of care with their standards, and we need their money to make this work. Thank you very much, Mr. Chair. Appreciate the time.
Point of information, Senator Balkis, you're recognized.
Thank you, Mr. Chair. Mr. Chair, for the record, the bill holds facilities, not the government of the Virgin Islands, accountable for compliance, and DHS is given oversight. Well, they have oversight through Title 19, but the enforcement provisions and the penalties apply directly to those facility operators. The government reduces its liability by establishing clear standards and compliance mechanisms. Now, yes, we do have some facilities that are under the government, but as you heard the numbers that were thrown out, 200,000, 100,000, that's peanuts. We have appropriated millions of dollars of funding, of local funding for all manners of things. And I'm not going to repeat what they are right now, but that is peanuts in comparison to some of those appropriations. Thank you for the time, Mr. Chair.
Yes, thank you, Senator Balkis. And I wanted to follow up on the Vice Chair's comments. You know, Ms. Martinez, I'm familiar with the budget situation at Herbert Grigg. Actually, I was a little disappointed to learn how limited the funding was for that facility. So with the goal now, because this bill is going to mandate that you provide an upgrade in care and services, and you're going to have to do an assessment. So the goal would then be, like the Assistant Commissioner said, to get the Medicaid funding. So more or less, what would it need so that you could qualify to get Medicaid funding? Because you alluded to maybe $1 million, 2.7 million. What would it need?
I don't, Ana Velez Martinez, when it comes to the numbers, then I will have to go and work those out. But we need a registered nurse to be in a facility 24 around the clock. I mean, so you need more than one RN. And those RNs basically come with a lot of experience, and they're over $80,000, $90,000 a year. You need total LPNs, you need CNAs to be able to meet those ratios. So right now, we don't have the staffing to meet our ratio. So it's going to be we're going to need some additional dollars for staffing.
So it's like a catch-22 situation. You can't bid Medicaid because you don't have those staffing, but if you had those staffing, you'll be able to
Because we got to meet the standards of Medicare.
So it seems to me like if you had those staffing, you'd be able to bill Medicaid. So let me ask you, because when you mentioned the nurses, the RNs, I understand your nursing contract is not the same like the hospital nursing's contract. Is that correct? Because the hospital nurses contract expires in September and they're up for renegotiation. What's the status with your nurses at Herbert Grigg, OAC, Dorset, Phillips?
Yes, 2 different unions. Go ahead.
Presently, they're still in 2 different unions.
2 different union. Why are they 2 different unions? RN is a RN is a RN. Is because one is human services, one is hospital?
One is for some of the nurses in the hospital are working at a different skill level because that's an acute care facility versus our long-term care facility.
Okay.
And Senator, I would like to add, well, I have Ms. Vincent give you some information on CMS requirements for long-term nursing
Yes, go
homes.
ahead, Ms. Vincent.
Kishma Vincent, Assistant Administrator. So as we were talking about the requirements for a CMS long-term care nursing home, the total nursing staff, first of all, the core requirement is a minimum of 3.48 hours of direct nursing care per resident per day. Okay? And then as far as registered nurses go, at least 0.55 hours of this total must be provided by RNs. nursing aides. At least 2.45 hours of this total must be provided by nurse aides for LPNs, CNAs, and the RN availability, like Mrs. Velez mentioned, we have to have a RN 24 hours a day, 7 days a week, which right now we have one person on St. Croix, and on St. Thomas we have a part-time RN.
Yeah. You see, I've visited that Herbert Grigg facility, right? A lot of the residents there are, you don't want to use a number, right? But they're kind of like the most unfortunate residents, and so they need the most attention and assistance for the government. And I think you mentioned that some of them we probably wouldn't even be able to bill the Medicaid, so that would strictly be a government issue. But I still think that we need to, I'm totally in favor of the bill because it upgrades the facility and it calls for the assessment. So the assessment now would be done by, the comprehensive assessment would be done by Human Services.
That is correct based on what the bill indicated, but I believe we're also going to have to rely heavily on our current Medicaid program and some of the technical assistance that's available via CMS or via our current contractors to help us tease this out. I would be remiss, we don't have like a statistical unit or an analytical unit here at DHS as a separate unit. All of the expertise that we have are program specific. So Homes for the Aged, they don't have any consultants or contractors on board right now that work specifically with that unit. So we would have to rely very heavily on our Medicaid program and the technical assistance that they can request to help us with this particular project.
Okay, and I want to follow up on that. Being that you're the Assistant Commissioner of Human Services, you have a lot of different programs, and the Medicaid program is actually administered in your division, in the Human Services Department. I think the Medicaid director reports to you, right?
That's correct, sir.
Okay, so that means that there would be a channel, a pathway so that they can get the funding quickly because, your Human Services, Medicaid is there. So, but how much will the new bill, the bill that was just recently signed into the president, how would that affect the Medicaid program?
So, Senator Fonseca, so that occurred just a couple days ago. We have not done as much of a deep dive over the weekend as we probably could have done. But we do know, based on some summaries that we've been receiving from our partnerships, that Medicaid and SNAP is going to be impacted mostly with work requirements that are added for current beneficiaries. On the Medicaid side, what is proposed is, or what is law now, I should say, is an 80-hour per month work requirement for any Medicaid beneficiary to still be current on the Medicaid rolls. Now, the majority of our Medicaid beneficiaries already work. So, there may be some additional cuts coming. Some people may fall off the rolls again, similar to when we had the COVID waiver was not extended. So, it's going to take a lot more teasing out on our part to look at the impact specifically for Medicaid. But there are other programs within DHS that are going to be impacted. CSEP is one. Our Meals on Wheels program is another. But again, permit us to have a little bit more time to do some additional dives into that.
Definitely, definitely. And I know last month, in May, we received testimony from the commissioner, the Honorable Avril George, whereas the Head Start program was cut $2 million more or less, but you're still able to accommodate all the kids. So you got to continue to work magic. Specifically, though, the 87% match, would that be affected, or will it be the same percentages?
From what we're getting from our CMS partners, that the match will not be impacted. Our FMAP will not be impacted by this.
Okay. So I commend the bill sponsor. I definitely think this is a good bill. Senator Clifford Joseph, you're recognized for your 5 minutes.
Thank you, Mr. Chair, and good morning to good afternoon, actually, to the listening public. Good afternoon to the testifiers. Good morning to my colleagues. Good morning to the central staff here at the legislature. One more, this question is for Human Services as far as stay, because in a long-term facility, my question would be to you, do Medicare and Medicaid and Medicare pay full payment for all of the stay of individuals?
Senator Joseph, good afternoon. Well, we cannot bill directly for Medicare or Medicaid at this time. The residents that are in our facilities, they would receive Medicaid covered benefits for things like their prescriptions and sometimes durable equipment like their walkers, canes, if they need transportation to doctor's appointments, the ambulatory transportation, those type of things is what would be paid for by Medicaid.
And Medicare, so they will only be paying for prescription that you said?
That's correct. Currently, Medicare pays for prescriptions for those residents who are Medicare beneficiaries.
So we in ourselves have some work to do too to get to standard in order for Medicare and Medicaid so we could build them.
Correct. Once our facilities are certified by CMS as a long-term nursing home facility, we will be able to bill for Medicaid. Medicare doesn't cover care for an elder resident in a facility that's just designated as a long-term care facility. Medicare will cover if you need to go to a skilled nursing facility, like let's say you're a stroke patient and you need some more rehabilitation, you could go in and get speech therapy, you could get occupational therapy, you could get wound therapy at a skilled nursing facility. But we are not that, and there are none in the territory right now.
Okay, on a personal note, when it comes to you said by 2028 you guys should have your building completed, or should be completed.
That's for Queen Louise.
Are you any part of is Human Services building any part of the Super PMO?
So the Super PMO does work with us and through the Office of Disaster Recovery on our projects. So we have project managers, architectural designers, those types of services. We access those services through ODR and the Super PMO.
But your actual, by the time your RFP goes out, it's going to be one sole contractor, because our facilities, medical facilities, need to be direct. We don't need to be, I think when it comes to the building portion, it needs to be directly to a contractor. Can we far behind the 8-ball when it comes to medical? And we need the facilities in place in order to moving forward.
Okay, so
Anyway,
go ahead.
No, I was saying if you didn't have the answer, well, okay, but I was saying if you had something to say, let me hear what you have to say, because my next question is geared to the Attorney General.
Okay, no problem. So what I was going to say is right now, for architecture and design, for our homes for the aged, Juridian Design is working with us on the major portion of that project. But again, it's through ODR and our and others.
Clear. Thank you for your answers. Question for Mr. Gordon Ray, Attorney General.
Yes, sir.
Should we separate the proposed measures into two? One that deals with the patient bills of rights, and the other that deals with regulations, so that we can have a clear outlook on these issues that we have in.
Okay, I'm not sure precisely how that would work. I guess you're asking whether or not the items that could ultimately end up in prosecutions or criminal violations, should they be in one section? And the other administrative items that deal with just the running of the process be in a different section?
No, because I want to make sure one will be under licensing and one will be under patient's bill of rights.
Okay. I haven't thought about this, but just off the cuff, it seems that since this is all one unified process, I don't see why it would have to be two separate bills. I think it could still be run as one, but the functions could be designated to the different agencies.
Yeah. Okay, thank you, because I do support the bill, but I just want to make sure. I just had that question to ask, so I asked it to you. Thank you, Mr. Chair, for the time.
Thank you, Senator Clifford Joseph. Colleagues, I'll allow a burning question. If the Senator Bulkis, you're recognized.
Thank you, Mr. Chair. If I may, I did not have an opportunity to...
Oh, yes, I'm sorry. You're recognized for your 5 minutes. Senator.
Thank you very much, Mr. Chair. Good afternoon, Mr. Chair. Good afternoon, colleagues. Good afternoon to the listening and viewing audience. Good afternoon, Central staff. And good afternoon to the testifying panel for Bill number 36-0003. First and foremost, I want to thank everyone here on the panel today because in some way, shape, or form, you all contributed to what is before us today, in addition to the fact that you're still contributing because there are just a few tweaks here and there that needs to be made to the bill, which I'm definitely looking forward to continue collaborating with you to make sure and assure that that's done at the appropriate time, if in fact the bill moves forward today, which I'm hoping. So I wanted to touch on, let's start with the AG's commentary surrounding the reporting of the violations. Mr. Attorney General Ray, I am aware that there are hotlines that exist currently on the national level that the Virgin Islands could partake in, or we can establish our own hotline. And I believe that we need to establish something that is easy for our senior or disabled community to be able to access without having it to be, too technology based, because not all of them have technological skills. And I believe that picking up the phone is one of the easiest things, and talking to someone would be one of the easiest way for us to report those violations. So I actually wanted to find out from everyone on the panel today, what are your thoughts surrounding a hotline?
You want to start?
Well, from the Attorney General's office and Department of Justice, I think a hotline would be extremely helpful, and definitely also a local hotline, because if there's some kind of real abuse going on or that sort of thing, we need to get local involved immediately, and also be looking at it for potential prosecution. I'd have to leave it to the agencies to tell us what the best way to do that would be, because we don't want to have multiple hotlines where you're going to the police or you're going to DHS or whatever. So I would suggest that there be some central local hotline, and then whoever's handling that could then allocate it out to whatever division would be best suited to handle the issue that was raised.
From the Department of Human Services perspective, currently any cases or reports of elder abuse, whether We receive them from a family member, the resident themselves, or from the police department. Those are usually channeled through our adult protective services line. And then our case managers will proceed with their internal investigation. Hotlines are a good idea, but from our standpoint, if it's going to be an unfunded mandate, then human services cannot absorb those costs within our current budget.
And if I may, before AARP responds, what would it take for violations to be added to that adult protective services hotline? Could we funnel those complaints to that hotline?
Well, I would say just complaints are already funneled to our adult protective services unit as part of their mandate. But they don't have a hotline. Reports can be made to our human services general operator, and then they're directed to APS, or we also have a direct extension that would get you to the APS department.
So potentially that streamline can be utilized for this, for what we're talking about, yes?
Yes, but hotlines take money, so let me say that again.
Duly noted.
We
but
can't
still,
absorb an unfunded mandate.
Duly noted, but that's still in place, and perhaps we can still look at that, because I believe that would be relatively low budget. Okay. Moving on to AARP, Director.
Yes, thank you, Troy Deschabert-Schuster, State Director of AARP in the Virgin Islands. And Senator Bolkes, thanks for that question. And as you are well aware, AARP is working on an anti-elder abuse legislation with you. And I think that would be a wonderful place to put a mandate for a well-funded hotline. We are also very much aware that adult protective services, they're understaffed, they're underfunded. Again, like so many people in our government, they're working so hard and doing their best with very, very little tools. So when it comes to elder abuse, whether it's in these homes for the aged or assisted living communities, whether it's in their own home, whether they're being affected by their own family and friends, I think a hotline will be really great. I know of several people who have tried to report elder abuse, and it's a big runaround, and sometimes they try to go to the FBI, sometimes they go to the United States Attorney, sometimes they end up being sent to the police department. The police department is overworked and understaffed, as we know, and sometimes it takes a long time to move those complaints through the police department before it finally gets to adult protective services. And it can be a very convoluted, very cumbersome process for people to report issues of abuse. So as we look forward to the very near future to moving that piece of legislation that we're working on with you regarding anti-elder abuse, I think that would be a really great place to insert a hotline and to make sure that it's well funded. And we have also been advocating for greater funding for adult protective services so that they can do their work efficiently. So again, thanks for the question.
And thank you, Director. And while I have you, you alluded to a Medicaid state plan amendment. Could you please elaborate a bit more on what you're envisioning there with that amendment?
Well, that's multifaceted and needs to be worked out by the Department of Human Services and Department of Health as to how we plan that out. But there are certain federal guidelines which have to be met, which are not being met right now. There are a whole lot of CMS guidelines that need to be met to make sure that we can live up to those standards. But as you pointed out also, in this legislation, we're looking forward to private investment. But I must say that when it comes to incentivizing private investment, we must be very aggressive. The government needs to be very aggressive with the benefits that are given to these private investors. Having been a pharmacy owner, a retail pharmacy owner myself, I can tell you that when it comes to Medicare, Medicaid reimbursements, the margins are very, 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 very small. It is not a profitable business at all. And when it comes to our gross receipts taxes and excise taxes for importing supplies and medications and so forth, the cost of customs and excise brokerage, the cost of electricity, the cost of water, the cost of doing business here in the Virgin Islands. We have to be extremely aggressive in giving great benefits to private investors who can come in here and help us to elevate our standards and therefore become CMS certified so we can experience the full benefits. So there's a lot to be said about this. I don't think we have enough time in this hearing, but at least we have begun the discussions and the dialogue.
And I appreciate that. And you would say that this bill now helps us move one step or a few steps, hopefully, toward that vision, correct?
Oh, absolutely, absolutely. It's well needed, and with all of the amendments that were suggested today, I think it'll be a really, really great bill and a really fantastic step in the right direction. But this is not something that we can just get signed into law and rest to the side. We have a lot of work to do. And the Commission on Aging, where we all come together, is a great place for us to continue the dialogue and to continue advancing.
Thank you. And you also mentioned, in addition, that you would like to see definitions for small home nursing homes, home and community-based services, and person-centered planning. Could you please, Mr. Chair,
Yes, you may.
Thank you so much, Mr. Chair. I wanted you to please elaborate a little bit more on that so that we are all of one mindset when it comes to what your suggestions are in those areas.
Yeah, so generally speaking, studies have shown that people do much better when they are in their home. But if they cannot be in their own home, they do also very well if they're in a facility that is like a home. So again, the small home model. We have a couple of them in St. Croix, which do well, but again, they need help, right, and support toward becoming CMS certified so that they can improve the quality of care and receive reimbursements from CMS, which is Medicare and Medicaid. So we need to look toward those models also, which is a type of private investment. So private investment could be either a larger facility or smaller homes, but we have to incentivize that properly. I hope I've answered your question. Is there anything
So
else?
that would create more beds, and it would create more options for our elderly, for assisted living care services, and then still, in turn, empower those smaller community-based HCBS entities to collect the Medicaid, Medicare, so that they're not reliant on just what is being paid by the resident. So you're saying that we should couple them and include them in this provision.
Right, and also home care as well. We have a great home care service here in Continuum Care, but Continuum Care Hospice, they are stretched to their limits. They also need some more support. They are CMS certified, and they do a really, really great job. I've seen them in action, but we need more and more of that. So small homes, home-based care in the individual's private or personal home, as well as skilled nursing facilities and larger private investment facilities. So it has to be very comprehensive, right? There is no one bullet that can take care of all of this. It has to be multifaceted.
Yeah. Well, as we continue to dialogue with the Department of Human Services, we'll see what options are available to be able to do that. But if in fact you would like to put anything on the record, I would encourage DHS to put something on the record in response. If not, we can just move forward.
Nothing to put on the record at this time.
Okay, very well. Mr. Chair, I want to thank you for the time, and colleagues, I would appreciate your consideration. Thank you.
Thank you, Senator Bolkes. Point of information, Senator Alma Francis Highland.
Yes, I have a burning question. Thank you. For me, listening to this conversation, it ultimately boils down to money. I understand that we're attempting to codify some of what is happening on a federal level, but ultimately, if we as a government, we're not putting the money where our mouth is, all of this sounds nice, but our people are not going to get the services they readily deserve. So for me, I'm still going to focus on the money part in trying to figure out what do we have to do for you so you could bill federal government agencies so we could make more money? What do we have to do for you to make sure you have all the tools that you need to make sure that you're self-sustainable? And in boiling down, when it comes to money, the question I want to ask, are you guys, we were talking about facilities earlier. I don't know if anybody asked this, but are you guys renting out facilities that could be of use, that are currently not in use, that's money being expended? I'm trying to see how we're utilizing dollars and cents to make sure it's being funneled in the right direction to guarantee that the services are provided to the seniors in this territory.
Good afternoon, Tasha Phillips Dorset, Assistant Commissioner, DHS. If you're referencing if we're renting space for any of the long-term nursing homes, the answer is no. We are not renting space. Those are government owned buildings that are being utilized.
So everything under your purview right now is being occupied, and that is there anything that's being rented that is unoccupied? That everything is all set? Because I'm just trying to cut costs and figure out how to get it more money directly to you guys by looking at everything from across the board.
There are other divisions within DHS that are renting space in the government, but not any that relates to the homes for the aged.
Directly with you guys. Okay. Thank you so much for that.
Thank you, Senator Alma Francis Heiliger. Senator Clifford Joseph, you're recognized for your burning question.
Thank you, Mr. Chair. Through the chair, I'd like for AARP, Mr. Director Schuster, to forward the amendments that he had, that in his testimony he said he had some amendments. I didn't have a chance to see them, and I'd like to have a chance to see what these amendments look like. Thank you, Mr. Chair.
Thank you, Senator Joseph. Senator Blyden, you're recognized for your burning question. Media mic for Senator Blyden.
Thank you so much, Mr. Chair. Let me get some clarification because I know State Director Schuster spoke to pivoting toward home and community-based care. And I know I asked earlier to the Department of Human Services, AC Dorset, in respect to Medicaid. And I just stated, for the record, can you clarify, Medicaid it's on behalf of the clients, correct?
That's correct. It's on behalf of the beneficiary. But if it's a person who's being cared for in their home by their family, Medicaid also has the personal care attendant program or PCA program, where a couple hours per week that person goes into the home. A staffer goes in, or a company goes into the home and assists the client. And then on our Senior Citizens Affairs program, we have the Homemakers program, and someone can go into their home and provide light cleaning, hair braiding, light cooking, those types of services. So that's outside of the nursing home.
Okay, very well. I know also AG Ray spoke to a system for reporting violators of this proposed legislation. In terms of funding, do we need funding to create a system, or that can just be done based on policies and procedures, etc.?
I think we would need some funding to help us draft all of the compliance documents, etc. I don't think the the expertise is available right now with the current number of staffing that we have. That is not to say that we don't have experts on our team. It's just very limited, and we are stretched because we're all pulling triple and quadruple duties.
And that's why I asked earlier also in terms of training and certification for staff and how often, etc. That's why I asked that question also. Okay, thank you for your responses. Mr. Chair, thank you for the time.
Thanks, Senator Blyden. Senate President Potter, you're recognized for your burning question.
I guess I'll ask a question. I wanted to just ask a final question about the current state of elder care in the territory. And are there documented problems that this legislation addresses?
Where I see this legislation being useful is, let's take, for instance, and this is just a hypothetical example. There's no real case that this is related to or anything like that. But if there was an instance of harm coming to, let's say, a resident of Lucinda Millen Home, which is an assisted living facility, if a report comes from Lucinda Millen, it would more than likely be channeled to our Adult Protective Services unit. In the past, Department of Human Services helped Lucinda Millen Home by sending CNAs and LPNs to provide care for those residents who live there who technically should have been in a nursing home or a skilled nursing facility. So I think with codifying the guidelines and ensuring that no client of an assisted living home is discriminated against, or they're barred from their application being put through, or if there's an issue with them with physical or emotional abuse, I think this piece of legislation would help to strengthen the process and to create more of a workflow or a business process that the reports could go through and be monitored timely and effectively. I'm not saying that our department does not currently manage and monitor these cases. What I'm saying is this strengthens and codifies it.
Understood. But are we seeing problems like the one you just sort of suggested that this bill would strengthen and would would provide the necessary safeguards? What are we seeing right now in the territory with regards to our nursing home? Are we seeing problems like that?
I mean, I think in any residential home or even the hospitals, sometimes you could get reports to like your patient advocate or a family member that there may be something that they feel the entity or facility is not doing correctly for their loved one, and there should be an internal mechanism to report that. I am always of the mindset that if there is a problem with a resident of a facility, the first report should go to the facility leadership instead of the FBI, as mentioned earlier, or the courts or some other folks. You have to let the facility where your loved one is residing know if you feel a staff person or a policy is not serving the best interests of your loved one, especially if you're paying for them to be cared at that facility. So I think anything that would provide more of a process for a two-way communication on behalf of the resident is a good thing. And I think that's why we at DHS are supportive of this measure. We don't state that, everything is 100% perfect at our facilities. Nothing can ever be 100% perfect. And there's room for improvement and room for growth, and this process will.
I ain't fishing for problems, I'm not fishing looking for problems. I just wanted to know, if there was some entity, some database or some records that would record, the state of affairs when it comes to our nursing facilities. Are we getting complaints? How many? That sort of thing. But that might be fun.
Our APS unit tracks that information, and I believe in August, Senator Bolkes, the Elder Abuse Registry bill maybe will come to the floor, and that would be a more appropriate mechanism and venue to kind of dive more into that issue.
Okay. Thank you, Commissioner. Thank you, Mr. Chair.
Thank you, Mr. President, for that line of questioning. Do I hear amendment? Senator Marvin Blyden, you're recognized for your amendment.
Thank you, Mr. Chair. Mr. Chair, I offer amendment number 34-406 to bill number 36-0003, offered by Senator Angel L. Bolquez Jr. Bill number 36-0003 is amended as follows. A, Section 1. 1. In internal Section 4122, A, insert the following new subsection C. C, a facility may not condition admission on repayment or other financial guarantees for services covered under Medicaid or other public assistance programs. B, to redesignate subsections C through F as subsections D through G, and add the following subsections H, I, and J. H, for any item or service listed in subsection D.
Motion, Senator Potter, you're recognized for your motion.
Thank you very much, Mr. Chair. Mr. Chair, I move to waive the reading of the amendment. I so move.
Motion to waive the reading of amendment to bill number 36003 has been properly made by Senator Milton Potter, seconded by Senator Alma Francis Heiliger, Senator Angel Bolkes, and Senator Lorenzo Frederick. Hearing no objection, so ordered. Motion, Senator Milton Potter, you're recognized for your motion. Marvin Blyden, you're recognized for your motion.
Thank you, Mr. Chair. Mr. Chair, I move. I so move.
So ordered.
Motion.
Motion, Senator Marvin Blyden, you're recognized for your motion.
Thank you, Mr. Chair. Mr. Chair, I move bill number 36-0003 as amended, an act amending Title 19 Virgin Islands Code relating to nursing homes and assisted living facilities by adding a new chapter 76 to establish the services that nursing homes and assisted nursing facilities are required to provide, establishing limitations on financial charges, requirements for visitation, and the rights of the residents be properly voted on in this committee and move to the Committee on Rules and Judiciary for further amendments and discussion. I so move.
Second.
Bill number 36-0003 as amended has been properly moved by Senator Marvin Blyden, seconded by Senator Milton Potter, Senator Alma Francis Heiliger, Senator Lorenzo Fredericks. Roll call.
Senator Hubert L. Fredericks.
Yes.
Senator Fredericks, yea. Senator Marvin A. Blyden. Senator Blyden, yea. Senator Ray Fonseca.
Yea.
Senator Fonseca, yea. Senator Alma Francis Heiliger. Yes. Senator Francis Heiliger, yes. Senator Kenneth L. Gittins. Absent. Senator Milton E. Potter.
Yes.
Senator Potter, yes. Senator Kurt A. Vele. Absent. Mr. Chairman, 5 yea, 2 absent.
Thank you, Mr. Clerk. Bill number 36-0003, as amended, an act amended Title 19 Virgin Islands Code relating to nursing homes and assisted living facilities by adding a new Chapter 76 to establish the services that nursing homes and assisted living facilities are required to provide, establishing limitations on financial charges, requirements for visitation, and the rights of a resident, has been voted upon favorably by this Committee on Health, Hospitals, and Human Services, and will be forwarded to the Committee on Rules and Judiciary for further review and action. Point of personal privilege. Senator Bolkes, you're recognized for your point of personal privilege.
Thank you, Mr. Chair. Mr. Chair and colleagues, I want to thank you for your vote of confidence on the measure, Bill number 36-0003. And I assure you that I will circle back with the Department of Human Services, the Attorney General's Office, and AARP to assure that the amendments that were suggested and discussed here today, along with other information that I've gathered, be reflected in the subsequent amendment in the Committee of Rules and Judiciary. So I want to thank you again, colleagues, and of course, thank you to the testifying panel for all of your collaboration and work. Thank you, Mr. Chair.
Thank you, Senator Bolkes. At this time, we'll allow a 30-second close. We'll start with Attorney General Gordon Ray, then we'll go to Mr. Schuster from AARP, and then we'll finish with Tasha Dorsett Phillip of Human Services. Attorney General, you may proceed.
Thank you. Attorney General Gordon Ray, and I'll just be very brief. I'm very much in favor of this legislation. I think it will make a big difference. And I assure everyone here that the Justice Department will work both in helping to draft the bill in its final form and definitely in enforcing it.
Thank you, AG Ray. Mr. Troy Schuster.
Yes, good afternoon. Troy Deshabir Schuster, AARP in the Virgin Islands. Senators, thank you so very much for this opportunity to discuss this bill, and I'm so pleased that it has moved through this committee positively, and I look forward to all of the amendments suggested being added as it moves on to Rules and Judiciary. And again, this is just the beginning. And it's a really, really, really great beginning. And I look forward to further discussions and even other bills, other measures to make this into something really, really great and improve the long-term care for all of the members of AARP and the entire older population of the Virgin Islands. So many of our people want to stay at home, if it's not in their own home, at least in the Virgin Islands, and receive excellent long-term care, and we can make that a reality. We just have to work together, and we can see great things for our people. So again, thank you so much, and at AARP, we stand committed to working with this legislature and with the Department of Human Services and the Department of Health as we look toward great things for our people. Thanks so very much.
Thank you, Mr. Troy Deshabert Schuster, and now we'll get the testimony from Tasha Phillips Dorsett.
Good afternoon again, Senator Fonseca and bill sponsor Senator Bolkes. On behalf of my commissioner, Avril E. George, we appreciated the opportunity to testify on this meaningful measure. Anything that can strengthen guidelines and the ability of us to provide quality services to seniors in the territory is a positive. Again, we will do what we have to do and what we're mandated to do to ensure the success of this measure. Again, just keeping in mind that unfunded mandates are difficult for us to digest as an agency. And I would like to thank all of the hardworking men and women at the Department of Human Services. The field of gerontology and elder care is not the most sexiest or glamorous field to work in, but the people who choose to work in those fields are passionate, they're hardworking, they're caring, and they just want to make life a little bit easier for that particular population. So if you see any of our senior citizens affairs workers out there and our nurses, nursing staff at our homes for the aged, give them a kudos, a thumbs up, and a good job. Thank you.
Thank you. So just for the record now, I got it right, Phillips Dorsett?
That's correct.
Thank you, thank you. So at this time, the testifiers are excused, and the Committee on Health, Hospitals, and Human Services stands in recess for 20 minutes.